Good morning. I've talked a lot about masks, and that's for good reason. If we want to slow the spread of the virus in our community, if we want to get back into school or keep our businesses open, then we have to follow our masking guidelines, our social distancing guidelines, and our crowd restriction guidelines. Through our Department of Public Health, we have given away over 2 million masks in St. Louis County. Behind me is another 200,000 masks that will be distributed later this week, and we have 1 million masks on order to be distributed later this summer. When the Federal CARES Act funding was sent to St. Louis County, I said it would be spent on the areas that needed it the most, on people and places who needed it the most, and that's exactly what we've done. Last month, I announced that residents in underserved parts of the county would be participating in a process called a participatory budget process that would help them decide what services they needed best to expand access to health care. So we asked residents in 18 areas of the county, 18 zip codes, based on census data, unemployment, poverty, limited access to health insurance, and the effect and cases of COVID-19 in those zip codes. And you see these zip codes on this map here. There are 17 zip codes in North County and 1 zip code in the southeast St. Louis County. Through an online survey, the Department of Public Health surveyed 324 residents in these zip codes and asked them to choose from services that had been identified by the Department of Public Health and our community partners. And I want to say thanks to everyone who participated in that process. Frequently, residents in underserved areas don't have a voice in what services they are able to receive. But through this process, they were able to advocate for themselves. Their voices were heard. So we'll review the $7 million that was identified for access to healthcare services by residents in these underserved areas. $1.5 million will go to improved access to testing. This is for testing in high volume areas, grocery stores, churches, schools, even for homebound seniors and disabled individuals. $2 million will be used to provide increased access to primary care services, preventive services, health screenings, immunizations, also dental services, diagnostic procedures, imaging, restorations, and screenings. Optometry services are also included. This includes eye exams, screenings, glasses, and contacts. $500,000 will be used to provide personal protective equipment, cleaning supplies, gloves, masks, and hand sanitizer. $2 million will be directed towards substance use disorder, mental health services, counseling for anxiety, depression, trauma, all of this in in-person visits or through telehealth. Also, mental health services provided will include psychiatric services for diagnosis and medication management, and these services will be available through telehealth or in person as well. $1 million is identified for miscellaneous emergency services, for co-pays, medical expenses, cost of prescriptions, or even technology access to participate in telehealth services. Our health department will begin seeking applications from community partners who can help us provide these services to our residents in underserved areas. And those applications will be available today at stlcronin.com. Also today, I'm pleased to announce that another $2.5 million will be available for our community health partners, community health centers, federally qualified healthcare centers to expand their existing testing services in St. Louis County. This is on top of the already $1.5 million of services for expanded testing that was identified through our community participatory budget process. Over the past 2 months, our testing partners in St. Louis County have provided initially 500 tests per day, but now are up to 1,500 tests over 1,500 tests daily. We know that testing is an important part of controlling the spread of this virus during this pandemic. It's an important part of helping to keep us safe. Our community health partners, federally qualified health centers, already have an infrastructure for testing in the community. So through this additional funding, we hope to build on that infrastructure and expand testing even further. And this funding for expanded testing is in addition to the testing that already takes place at the St. Louis County Health Department. And you can make an appointment for testing at no cost through the St. Louis County Health Department at stlcorona.com. We're proud to support our safety net partners, federally qualified health centers, community health centers, who along with the St. Louis County Public Health Department provide important access to care for uninsured and underserved in St. Louis County. So this additional funding through the Federal CARES Act that we're announcing today will move to further improve access to care for uninsured and underinsured patients in St. Louis County. Thank you, and I would be glad to answer any questions.
Have you came back yet on anything with the youth sports? I mean, is there any timetable on that, or where do you stand with that right now?
Well, we follow the recommendations of our youth sports COVID-19 task force, which was to move back to phase 1 for youth sports and allow them to practice, but limit the activities surrounding youth sports that were associated with high risk for COVID-19 transmission. Those activities were gatherings, social events, team meetings, and events that attracted fans. And we're going to follow those recommendations. We see this happening across the country because we are certainly concerned that increasing transmission amongst folks participating, watching youth sports has a real risk to slowing down our ability or preventing our ability to get kids back into school this fall. We want to preserve that option if it will be available for in-class learning, but we also understand that we will very likely have a lot of our community participating in virtual classrooms this fall, and that's my recommendation to anyone who's trying to make a decision moving forward about education options for their child, that if virtual classroom is an option, that would be my recommendation.
And you kind of mentioned it just last night. Hazelwood approved to have their schools virtual to start off. Something you've been kind of advocating for parents to choose. Talk about your reaction to that last night's vote.
My position is the same. We really need to get folks in our community to adopt masking. We need to get masks on everyone. And until everyone is masking, until we have acceptance of social distancing, until we have exceptions of our crowd restrictions, however frustrating they may be, until we have those exceptions, COVID will continue to spread in our community. It will threaten school reopenings, and it will threaten our ability to keep businesses open. And we see this happening across the country. We have to get folks here to accept our social distancing guidelines and wear masks, or this virus will continue to spread. That will affect our schools. With what we know now, with the information we have now, with where we are with COVID in our community, there is certainly the possibility that we could have some in-classroom learning, and we want to keep that possibility open. But I am encouraging parents, if they have a choice, to choose a virtual option for this fall, this first semester.
What would you say to the parents that don't?
Well, we'll have to work with them, because there are some settings where kids and families of first responders and those sort of things, they need a place to go and they need a place to learn. We have a technology gap that's well identified in our community. It is part of the equity challenge that we face with every complex policy question in our community. And how do we address the digital divide? Not just access to tablets, but also access to high-speed internet. And we'll be talking more about our county efforts to set aside $4 million from the CARES Act fund to try and address that technology gap for people or families in our community and places in our community where ability to participate in a virtual classroom is going to be difficult. And we're talking to our superintendents now about how we can close that gap. Any other questions? Doug, you have anything?
Yep.
Okay, thanks a lot.